Dr. Hans Schmidt, director of the Bariatric Surgery Center at Hackensack University Medical Center. Thanks so much for being with us.
Thanks.
Okay, so the governor confirms that he had the surgery today. Obviously, he's going to lose weight. We've heard that he's probably lost already around 40 pounds. What can he expect from this surgery?
After the initial weight loss, which is typically 30 to 40 pounds in the first month or two, I'd expect him to lose about 10 pounds a month from this point out.
Wow.
For how long?
It all depends on how much weight you have to lose. I think he has to lose a significant amount of weight, so hopefully that, continues on for a year or two.
And this was the less invasive option. You've got something to show us right now, essentially what he had done. Walk us through it quickly.
So this is the gastric band. It's placed right below the top of the stomach, and what it does is just slows the rate of food going through. So as the food comes down, it sits up here for a while before it continues into the rest of the stomach. That makes patients full quicker and hopefully full for longer, so they eat less food.
Okay, so when you achieve your goal weight, what happens? You still have that on. You're saying that you can lose 10 pounds a month, but obviously at some point you got to stop.
Correct, and it can actually be loosened. It's adjustable, the band, so there's a little fill port that goes underneath the skin, which this tube connects to, and then the band can be loosened or tightened. So hopefully once he gets near his target weight loss, you can loosen it up a little bit, and he can eat more normal portions and still maintain.
And we just saw, Rex Ryan do the same thing. We've basically been doing these surgeries for about a decade now. This is much less invasive. It's reversible. Is this sort of the future? Do you think more people are going to go in this direction?
The band is probably not for everybody. I think there's certain patients that do better and some that don't do as well. So I think for the right patient, it's a fantastic operation.
And on this point, doctor, before we let you go, we should let folks know of the risks of doing a surgery like this.
The lap band is probably the safest of the operations we do in the short term. There's very few immediate surgical complications, which is a reason it's great for like a governor who can't be laid up. But there can be some long-term consequences.
And one more very important question. How much does this cost?
The good news in the tri-state area is that most insurance companies cover it. So it should go through insurance. I think if you do it on your own, though, probably $20,000 to $25,000 at most hospitals.
But you might be buying yourself a lot of more time, though, all the problems that come with obesity. So
it's a big problem.
It's huge. All right.